What did your tragic death on a football pitch, an 18th century medical rebellion, and a psychiatric evaluation in a modern courtroom all have in common?
Well, it sounds like a setup to a really complicated joke, honestly.
Right, but they actually all hinge on one tiny five-letter fragment of
Mm.
language.
Mm.
And, when you're sitting in a doctor's office and they hand you your chart or you look at your test results on your phone, there was always that moment of panic.
Oh, absolutely. The dreaded portal notification.
Exactly. You open it and you see this massive 20-letter word, and it just sounds like a death sentence.
Yeah.
Feels incredibly intimidating, like this impenetrable fortress of Latin and Greek designed to separate the experts from the patients.
Which is completely by design historically, but the secret is those terrifying words aren't actually fortresses.
No.
They are more like little plastic Lego bricks clicked together. And once you learn how to spot the seams between those bricks, the entire medical vocabulary demystifies itself.
You stop seeing a wall of text and start seeing a very literal set of instructions about what is actually happening inside the human body.
Yeah, exactly.
Which brings us to our topic today. Welcome to this custom-tailored deep dive made just for you. We've gathered a fantastic stack of sources for this one. We've got medical terminology notes, historical case studies, some really fascinating clinical definitions.
It's a great stack today.
It really is. And our mission here is to look way past the dry textbook definitions. We are going to unpack the bizarre split personality of one specific Lego brick, and that is the medical suffix apathy.
Pathy.
Right, because understanding this one little suffix is basically a shortcut to being a better informed patient, a sharper media consumer, and a smarter navigator of everything from professional sports policies to alternative medicine debates. So, okay, let's unpack this. How do we build a medical term from scratch?
Well, we can stick right with your Lego analogy because medical terms are essentially miniature sentences built out of modular components. You usually start with a prefix, though, that's optional.
Like a modifier.
Right, it adds a qualifier like under or over. Then you snap on a root word, which typically names the specific body part or tissue you're dealing with.
Okay, got it.
After that, you add a connecting vowel. It's almost always an O, just to make the whole thing pronounceable. And finally, you click on the suffix at the very end. The suffix is the crucial piece that names the actual condition or disease or procedure.
And pathy sits entirely in that suffix slot.
Exactly.
So in standard modern medical terminology, it simply means disease of or abnormal condition of. So let's say a doctor wants to note that a patient has a disease affecting the muscular tissue of their heart. Writing out that entire phrase every time is pretty clumsy.
Oh, it's incredibly inefficient. I mean, doctors don't have time for that. Instead, the physician grabs cardi for heart, snaps on an O, adds myo for muscle, snaps on another O, and attaches pathy at the end.
Cardiomyopathy.
Right. With 4 modular blocks, you've instantly communicated a highly specific clinical diagnosis.
It's a really elegant system. But looking at the sources, this systematic snapping together of words wasn't always how medicine worked, right? The origin of the suffix goes all the way back to the ancient Greeks, specifically the word pathos, which meant suffering, misfortune, or really just whatever befalls a person.
Yeah, but the Greeks weren't walking around diagnosing myopathy.
No, they definitely weren't.
Right. For centuries, European medicine was dominated by the concept of humoral imbalances. If you fell ill in the Middle Ages or even the Renaissance, your physician wouldn't look at a specific organ at all.
They were looking at the fluids.
Exactly. They believed your sickness meant your 4 bodily fluids, blood, phlegm, yellow bile, or black bile, were just out of proportion.
So you didn't have a diseased heart muscle, you simply had too much yellow bile.
Basically, yeah.
So how did we transition from blaming yellow bile to this rigorous tissue-specific Lego system we use today?
Well, the massive turning point arrived in the mid-19th century, and it was driven largely by the microscope. There was this German pathologist named Rudolf Virchow.
Right, the sources mention him.
Yeah, he was studying human tissue, and in 1858 he published a landmark text called Cellular Pathology, or Cellular Pathology. And Virchow proved that diseases don't just float around in vague bodily fluids.
Anchored somewhere.
Yes, they originate in specific cells and specific tissues. If a person is sick, there is a localized physical breakdown happening somewhere. Virchow's work cemented the intellectual foundation that allowed our modern naming system to really flourish.
Because you needed to pinpoint the exact tissue to name the disease.
Precisely, and burpathy became the standard tag for that localized breakdown.
So Virchow standardizes the suffix to mean a very literal physical disease of a tissue. But looking at the English language, this presents a massive contradiction.
Oh, big time.
If peripathy means a physical disease, why do we have a whole dictionary of parathy words that have absolutely nothing to do with sick organs?
You're spotting the linguistic fork in the road here. Remember that the original Greek root pathos meant suffering, but it also carried a broader meaning of feeling or emotion. That emotional branch kind of splintered off and gave us words like empathy, sympathy, apathy, and telepathy. In those specific contexts, the suffix just denotes a state of feeling.
I have to admit, when I hear a word like empathy, it sounds incredibly noble and ancient. You just picture Plato or Aristotle walking around in togas, giving lectures on the importance of empathy.
Right. But the classical vibe is definitely deceiving. The English word empathy is barely a century old.
Wait, really?
Yeah, it didn't exist during the classical era or the Renaissance or even the Victorian era. It was coined in 1909 by a psychologist named Edward Titchener.
1909. That is wild.
Yeah, he needed an English equivalent for a German aesthetic concept called Einfühlung, which literally translates to feeling into, the idea of projecting yourself into a piece of art or another person's emotional state.
So while sympathy has been in the English lexicon since, what, the 1500s?
Empathy is younger than the airplane.
That is amazing. A word we treat as a fundamental human virtue was basically invented for an early 20th century psychology paper. But the sources show another major divergence, a third branch that makes this suffix even more chaotic. We have Virchow's physical disease branch, Titchener's emotional branch, and then we have a treatment branch.
What's fascinating here is that this one formed at the exact same time Virchow's tissue-based medicine was taking off.
Late 1700s, right?
Yep. In 1796, a German physician named Samuel Hahnemann was growing really horrified by the mainstream medicine of his era, and frankly, he was justified.
Because of the treatments.
Right. Doctors were routinely treating illnesses by draining pints of blood from patients or dosing them with toxic heavy metals like mercury. The quotes in the sources talk about how these cures were violently depleting the patient's bodies.
They were undoubtedly accelerating people's deaths in the name of healing them.
Yeah, Hahnemann desperately wanted a gentler alternative, so he developed a philosophy he called like cures like.
How did that work?
Well, he hypothesized that if a substance causes symptoms in a healthy person, say, an onion making your eyes water, then a microscopic, heavily diluted amount of that same substance could cure a sick person with watery eyes.
Oh, I see.
And to name his new philosophy, he hijacked our suffix. He combined the Greek word homoios, meaning similar, with pathos, homeopathy.
So he took a suffix that meant disease and repurposed it to name a treatment philosophy, which completely explains why consumers today are still so confused.
Absolutely.
On one side, we have rigorous cellular disease classification. On the other side, an alternative treatment explicitly born as a rebellion against mainstream medicine. Let's pivot back to that clinical tissue-based branch, though.
Good idea.
I want to explore how these terms play out in real life because these are life or death diagnoses. Let's look at cardiomyopathy. We know it means heart muscle disease. But what is mechanically going wrong?
The mechanics are vital to understand here. With cardiomyopathy, we aren't dealing with a plumbing issue, like a clogged coronary artery, and we aren't dealing with a hardware issue, like a faulty valve snapping shut.
Right, it's the muscle itself.
Exactly. The actual muscle tissue of the heart wall is structurally compromised. It might become rigid or stretched out or abnormally thick.
The sources highlight a specific variation called hypertrophic cardiomyopathy, or HCM, which involves an abnormal thickening of that heart muscle. What stood out to me is how common it is. It affects about 1 in 500 people.
It's surprisingly common.
And how stealthy it can be.
Yeah.
It is frequently cited as a leading cause of sudden cardiac death in young, seemingly peak condition athletes.
Yeah, because the muscle wall is too thick, the heart has to work much harder to pump blood. Under extreme physiological stress, like a high-stakes athletic match, that thickened muscle can trigger a fatal electrical short circuit in the heart.
I read about the case of Marc-Vivien Foé in the sources. He was a Cameroonian international footballer. In 2003, he was playing in a massive Confederations Cup semifinal match in France. Out of nowhere, he collapsed on the pitch and passed away.
Such a tragic story.
It really is. The autopsy later revealed he had HCM. It wasn't a tackle. It was this hidden cellular defect. And his death sparked intense ongoing policy debates worldwide about whether every professional and collegiate athlete should be subjected to mandatory cardiac screening.
It takes a microscopic tissue problem and turns it into a billion-dollar sports administration issue.
Exactly. Now let's examine another one with massive scale. Diabetic neuropathy. Neuro means nerve, so we're dealing with a nerve disease.
Right, but attaching diabetic to the front tells us the precise story of how this damage is unfolding over time.
The numbers on this are staggering. The American Diabetes Association estimates that up to half of all people with diabetes will eventually develop some form of neuropathy. Millions of people. So how does elevated blood sugar actually destroy a nerve?
It is a slow, chronic metabolic injury. Your nerves require oxygen and nutrients to survive, which are delivered by microscopic capillaries. When blood sugar remains elevated for years, that glucose essentially acts like sandpaper inside those tiny blood vessels.
Wow, sandpaper.
Yeah, scarring and damaging them. When the blood supply chokes off, the nerve fibers begin to die. Because the longest nerves in the body reach all the way down to the toes are usually where the damage manifests first.
So they feel it in their feet first.
Exactly. Patients experience numbness, tingling, and severe burning pain that slowly creeps upward. Clinicians refer to it as a stocking glove distribution because the loss of sensation mirrors the exact areas a physical stocking or glove would cover.
So the term neuropathy isn't just a label for pain. It's a description of cumulative vascular starvation.
Spot on.
That brings us to the third major example from the sources, which has absolutely dominated the cultural zeitgeist. CTE, or chronic traumatic encephalopathy. Encephalo means brain. Progressive brain disease from repeated trauma. I know Dr. Bennett Omalu first identified this in former NFL player Mike Webster during a 2002 autopsy. But what is the actual mechanism? How does hitting your head destroy the brain tissue?
To understand CTE, you have to look at a specific element called tau protein. Think of your brain cells having these tiny internal railroad tracks that transport vital nutrients back and forth.
Okay, Drax.
Tau proteins act like the railroad ties holding those tracks together. When the brain takes repeated violent impacts, those ties get knocked loose. The tau proteins detach and begin clumping together in abnormal tangles.
And without the ties, the tracks fall apart.
Yes. Without the ties, the cellular tracks collapse and the brain cell eventually dies. Over years, these toxic clumps of tau spread, physically shrinking the brain and eroding memory, judgment, and emotional control.
That railroad tie analogy makes the horror of it so clear. The sources detail the case of Aaron Hernandez, the former NFL tight end.
Yeah, that case was huge.
When researchers at the Boston University CTE Center examined his brain after his death in 2017, they discovered he had stage 3 out of 4 CTE. He was only 27 years old.
It's terrifying.
The structural collapse of his brain at that age was unprecedented. The fallout from these discoveries resulted in a massive concussion settlement, with the NFL potentially exceeding $1 billion, and it fundamentally altered how we view youth sports safety.
It really changed the conversation.
It did. But I have a huge question about this. You constantly hear sports commentators say about a player acting erratically, he definitely has CTE. Is it medically possible to diagnose a living person with CTE?
That is one of the most pervasive misconceptions in sports media today. The absolute reality is that CTE cannot be definitively diagnosed in a living patient.
It can't.
No. We can strongly suspect it based on behavioral symptoms and a history of concussions, but the formal diagnosis requires a physical autopsy.
I see.
A neuropathologist must slice the brain tissue, dye it, and examine it under a microscope to visually confirm those clumps of tau protein.
So every time someone on television claims a living athlete has CTE, they're making a massive medical leap.
Yes, they are.
Okay, so we've talked about very clear physical damage, thickened muscles, starved nerves, collapsed cellular tracts. But what happens when we apply cardiopathy to conditions where the mechanics are completely unknown?
That's a great question.
If I'm sitting on an exam table in a paper gown and a doctor tells me my lung condition is idiopathic, I'm probably going to feel terrified and honestly a little brushed off. Is idiopathic just a fancy medical shrug?
It is entirely understandable why patients feel dismissed by that word. It comes from idios, meaning one's own or distinct, and pathos.
So it feels like the physician is saying, you have a disease and we have no idea why.
And practically speaking, that is what it means. A disease has arisen spontaneously and no cause has yet been identified. But it is crucial to view idiopathic not as a permanent verdict of ignorance, but as a snapshot of current scientific limitations.
So as our microscopes get better, the idiopathic category gets smaller.
Precisely. Decades ago, massive categories of disease, like certain forms of pulmonary fibrosis or scoliosis, were considered entirely idiopathic.
And now,
Today, thanks to advances in DNA sequencing and molecular biology, we have identified specific genetic mutations or environmental triggers for many of those exact same conditions. They shed the idiopathic label as soon as we discover the mechanism.
that makes total sense. What about when psychopathy is applied to the mind itself? The term psychopathy is fascinating. Psyche plus pathos. This isn't a diseased tissue, it's a diseased personality.
Right. The concept originated with 19th century German psychiatrists who needed a way to describe abnormal antisocial behavior that didn't stem from a physical brain
Like
lesion.
Virchow was looking for.
Exactly. But the modern definition was heavily shaped by Hervey Cleckley's 1941 book, The Mask of Sanity, and later codified by the Canadian psychologist Robert Hare in the 1980s.
Hare developed the psychopathy checklist, right?
Yes, the PCLR, which tracks traits like grandiosity, manipulation, and a profound lack of empathy.
I need to clarify a massive misconception the sources point out here. People constantly conflate psychopathy with psychosis because they sound so similar, but they're entirely different mechanisms.
Completely different. Psychosis is a literal cognitive break from reality, experiencing hallucinations or delusions. Psychopathy is a personality construct where the individual is perfectly tethered to reality. They just lack a conscience.
So a term we use to judge violent criminals isn't even in the psychiatric rule book. How did that happen?
It's one of the great paradoxes of modern psychology. If you open the DSM-5, the official diagnostic manual of psychiatry, psychopathy is nowhere to be found.
Nowhere.
No, the closest official diagnosis is antisocial personality disorder. Yet, despite lacking official diagnostic status, Hare's psychopathy checklist carries immense weight in the criminal justice system. It is routinely used to determine risk assessments and can heavily influence whether an inmate is granted parole.
It's fascinating how psychopathy has massive real-world consequences despite lacking official diagnostic legitimacy.
It really is.
That tension between what's officially recognized by the medical establishment and what operates outside of it actually brings us back perfectly to that treatment branch we mentioned earlier.
Ah, yes.
Let's look at the great rivalry, homeopathy versus osteopathy. Both movements were born in the 1800s. Both founders, Samuel Hahnemann and Andrew Taylor Still, were rebelling against the horrors of bloodletting. And both hijacked the Greek suffix to name their alternative therapies.
Right.
But their fates diverged completely. Why did one survive while the other failed?
It entirely came down to their willingness to adapt to the scientific method. With homeopathy, the core premise that diluting a substance in water until not a single active molecule remains somehow increases its healing power violates the fundamental laws of physics and chemistry.
It just doesn't work.
The practice refused to evolve. The sources cite a landmark 2015 review by Australia's National Health and Medical Research Council, which analyzed 225 research papers covering 68 health conditions.
And what did they find?
The conclusion was absolute. There is zero reliable evidence that homeopathy is effective. It remains widely classified by global scientific bodies as pseudoscience.
But osteopathy took a completely different trajectory. Andrew Taylor still originally focused on physical manipulation of the bones and joints to promote healing. But over the 20th century, osteopathy in the United States decided to embrace rigorous evidence-based medicine, pharmacology, and clinical trials.
They integrated. Today, doctors of osteopathic medicine, or DOs, attend fully accredited, rigorous medical schools. They complete the exact same hospital residencies as MDs.
They prescribe antibiotics, perform complex surgeries.
Exactly. They are fully licensed mainstream physicians who simply receive supplemental training in manual physical medicine.
The sources indicate that roughly 1 in 9 physicians in the U.S. today holds a DO degree. So you have two therapies born in the same era with the same suffix. Because one rejected the scientific method and one embraced it. Today, one is selling expensive sugar water and the other is performing open heart surgery.
Geography also plays a funny role here, though.
Oh, really?
Yeah, if you travel to the UK, osteopathy never merged with conventional medicine. It remained a separate, alternative manual therapy profession. So depending on which side of the Atlantic you were on, the exact same myelopathy carries a vastly different clinical weight.
This is why consumers have to be so vigilant. You can't just trust a scientific-sounding Greek suffix on a clinic sign.
Definitely not.
To wrap up the technical side of this deep dive, let's give you, the listener, a diagnostic toolkit. Where does myelopathy sit among all its suffix neighbors?
Think of it like a medical decision tree. If a doctor is looking at a problem, they have highly specific tags. If a tissue is inflamed, they use itis, like appendicitis or arthritis.
Okay, and if it's not inflamed?
If there is a chronic, non-inflammatory degeneration, they use osis, like cirrhosis of the liver.
What if they find a physical lump or a mass?
That gets the suffix oma, carcinoma, lipoma. If the primary symptom is intense pain, you'll see algia or dynia, like fibromyalgia.
Okay, got it.
If an organ is growing too large, it's megaly, like cardiomegaly. If it's wasting away, it's atrophy. If it's a blood condition, it's anemia, like anemia. And if the surgeon is cutting into you or removing something entirely, you'll hear ectomy or otomy.
I love this. It's exactly like a car mechanic's diagnostic menu.
It really is.
If the engine's running hot and inflamed, it's an itis. If there's a visible lump on the tire, it's an oma. But if there's just a general breakdown of the engine block and the mechanic doesn't want to specify the exact mechanism just yet, epathy is the ultimate fallback term. It is the general purpose label for disease of.
It is the workhorse of the medical dictionary. If a condition doesn't neatly fit the criteria for a tumor or an inflammation, it gets filed under apathy.
Understanding this structure helps you advocate for your own health. When a doctor hands you a chart with a terrifying 20-letter diagnosis, you now know how to pull it apart into its Lego bricks and ask pointed questions about the mechanics. It helps you decode those sensationalized sports headlines about CTE, knowing exactly how the diagnosis actually works. And it helps you navigate the confusing wellness industry, where a Greek suffix might be masking unsupported pseudoscience. Thank you for taking this deep dive with us. I'll pass it over to my co-host for one last thought.
Before we go, consider this. The entire systematic Lego brick naming system we rely on was built by Virchow and his peers in the 1800s. They organized the medical world based on what they could physically see under a microscope: organs, tissues, and cells.
Right.
But modern medicine is rapidly accelerating past the cellular level. We are mapping human genomes, utilizing CRISPR technology, and targeting the precise DNA mutations that cause the tissue to fail in the first place. As we move from treating the physical organ to rewriting the genetic code itself, we have to wonder, will our classification system eventually outgrow these 200-year-old Greek roots? Will a completely new naming system emerge from molecular and genetic interventions, finally rendering apathy obsolete in the medicine of the future?